Kenya has received the first batch of the one-shot Johnson & Johnson COVID-19 vaccines. The first consignment of 141,600 doses of the J&J vaccine now widens the portfolio of COVID-19 vaccines available for the national vaccination rollout. The country has also received an additional 55,000 doses of the AstraZeneca vaccine from the government of Latvia. This comes as residents of Rongo, Migori County call for equity in the ongoing vaccination program. They claim that only civil servants are getting the jab while the rest of the population is yet to receive even the first dose. Rose Wangoi has more.
The cargo plane carrying the consignment of Johnson & Johnson COVID-19 vaccines touched down at the Jomo Kenyatta International Airport on Friday night. The consignment was received by Chief Administrative Secretary in the Ministry of Health, Dr. Mercy Mwangangi, and the Chairman of the COVID-19 Vaccine Development Task Force, Dr. Willis Hawale. The consignment is the first batch of the 141,600 doses for Kenya of Johnson & Johnson vaccine. Dr. Mwangangi said the Ministry of Health has purchased another 13.3 million doses.
Next week, we are hoping to get another consignment of about 242,000 doses. And our aim is that every month we'll be able to get at least 1 million doses of J&J.
Kenya has received an additional 55,000 doses of the AstraZeneca vaccine from the government of Latvia. The donation from Latvia arrived in the country today morning. The vaccines were received by the chairman of the Vaccine Procurement and Logistics Committee, John Kibuchi, and the acting ambassador to the EU in Kenya, Catherine Hackman, at the Jomo Kenyatta International Airport. Dr. Mwangangi said the vaccines will help boost the country's vaccination efforts at a time it is battling a surge in infections. The CAS insisted that there is no vaccine that is superior to the other from the three types of vaccines that have been received in the country.
Moderna, AstraZeneca, and Johnson & Johnson have the ability to prevent you from ending up in an ICU bed. So come forward and receive your vaccine.
While the urban population is desperate to get a jab to protect themselves against COVID-19, majority of people living in rural areas are yet to be vaccinated. In Rongo, Migori County, residents claim they're being left behind in the mass vaccination.
Why is it that only the civil servants are being vaccinated? Does it mean that those who are in the rural areas, they're not part of the Kenyan citizens?
It is high time for the government to reach out even to the rural areas so that we can get this vaccination.
Dr. Hawale said vaccines will be fairly deployed across the country to ensure equity.
Increasing vaccination posts, taking them close to the people, outreaches, doing targeted mass vaccination centers, and also doing something we are calling enriches, where you even vaccinate elderly people within facilities.
So far, over 800,000 people have been fully inoculated. The latest consignment pushes the number of vaccines received in the country to over 4 million. Dr. Mwangangi called on Kenyans to avail themselves of the jab, saying that the government has increased the availability of the vaccines. Rose Wangoi, NTV.